Hi, I'm Armida Carr, bilingual speech language pathologist, owner, and founder of New Horizon Therapy. Welcome to Therapy Thursday, where I take a few minutes to talk about a topic as it relates to speech and occupational therapy in both children and adults. And today's topic is milestones, and more specifically, the age of 2. What should my child be doing at the age of 2? What should we be looking for? Because this is a time when most of our clients, we get the most phone calls on with the kids that are between the ages of 18 months to 2.5, 3 years old. And I think the big turning point is around that age of 2, when parents start to notice how their child is communicating. So this is when, again, we get asked, what should my child be doing by the time they're 2? So things to look for when a child is 2. Most kids by the time they're 2, they do have 200 words. They're starting to combine 2 words together to make short phrases. They're starting to follow simple related commands as, pick up your shoes and bring them to me. They are starting to imitate and pretend play. And, if you're, whatever you do, whether you're doing the dishes, cooking, or fixing the car, around this time you start seeing the kids kind of imitate and using those gestures that you use. And then we also want to see around this time, they're understanding action words: stop, go, simple ones like that. And then one of the last ones that I can kind of think of is, they're starting to enjoy stories and listening to stories and sitting down and paying attention, not for hours, but at least getting them to sit for at least 10, 15 minutes. So those are some of the few things that we should see in a 2-year-old. All kids are different. There's also a lot of factors, if the child is spoken to in several languages, or if the parents have communication difficulties. So every child is different, but I always tell parents, if you have that gut feeling of something is not right with my child, reach out. We are here to help, answer questions, whether you come to the clinic or not, to put that mind at ease or guide you in the right direction and tell you, this is maybe where you should go, or this is maybe what you should do. I'd be more than happy to do that, because we want our kids to be functioning by the time they go to kindergarten and be able to have friends and socialize and ask questions, answer questions. So that is the age of 2. Fun age, love that age. But again, thank you so much for joining me for Therapy Thursday. Ask questions, leave comments, and we will see you next Thursday.